Well, in today's Wellness Wednesday, the COVID-19 pandemic is putting a new emphasis on mental health, with many people reporting higher levels of stress, depression, and feelings of isolation as they stay home more often. Unfortunately, there's still a stigma surrounding mental health, and people may be struggling while not receiving the help and support they need. Joining me with more on this topic is Regence behavioral health consultant Fayth Dickenson. Fayth, thank you for joining us this morning.
Good morning. Thank you for having me.
Of course, first question for you. Of course, there's been an incredible number of stressors this year between COVID, wildfires, unrest across the country. What kind of mental health issues are we seeing more of?
Well, as you can imagine, with the isolation that we're seeing and the social distancing, it has really taken a toll. We are social creatures, by nature, and we're losing that connectedness that we have when we're in the company of family and friends and our social groups. So we're seeing a huge rise in the symptoms of depression and anxiety. I mean, in fact, 3 times more than we're used to seeing. So a lot of those symptoms are really sometimes hidden. And as you mentioned, they're hidden by the stigma. And that's something we've got to be looking at and working on.
Right. Now, tomorrow on that note is National Depression Screening Day. And this Saturday is World Mental Health Day. Why are these important to note?
Well, Depression Screening Day is really important because it reminds us to take a minute to remind everyone and ourselves how common depression is, but also how serious it can really become if we don't notice the signs and symptoms and reach out for help. And so the depression screenings can really offer you a little bit of insight into where you are on that spectrum and when is it time to ask for help.
Of course. Now, this might be the biggest question of the morning. If we do notice signs of depression or any of these issues in ourselves or in a loved one, where can we turn to for help?
There's a few different resources. I would say first, really encourage people to reach out. Family and friends as the first step, the first line of defense. Primary care physicians are another great resource because that's one of the most trusted providers in a person's life. But also the National Alliance on Mental Illness, Mental Health America, the Idaho Suicide Prevention Hotline. All of those resources can offer assistance in finding the right kind of help.
Perfect. And how about just out in the community? How can we inspire a little change and maybe some hope?
That comes down to every one of us. Being willing to talk about our own struggles encourages others to be able to talk about theirs. So being open about what we're all experiencing right now is the number one key.
Perfect. Okay, and last question for you. For anybody else looking for some help or just some other resources, where can people go for that?
I would really recommend checking out the National Alliance on Mental Illness online and mentalhealthamerica.org. They have resources that will direct you to all of the local sites, all of the local and national hotlines and information resources.
Okay, perfect. And Regence behavioral health consultant Fayth Dickenson, thanks for joining us this morning.
Thank you, Matt.